Welcome, my name is Peter Strong. I'm a professional psychotherapist based in Boulder, Colorado, but I offer online therapy over Skype for working with anxiety and depression, addictions, and many other common psychological problems that really benefit from the methods of mindfulness therapy, which is what I teach. So people ask me all the time, is it becoming more common now to do online therapy for anxiety or depression? And it is. More therapists are now offering online therapy because it makes it more available, and that's a great advantage. It gives you more choice too. As a client, you can search online for the right therapist that you feel comfortable with, and also to find someone who offers the right approach that resonates with you and your particular needs. So online therapy is a very good option if you're looking for a non-medical treatment. And most people don't need a medical treatment for their anxiety. They simply need to learn more effective ways of working with their anxiety and other emotions associated with anxiety. So mindfulness therapy is one such approach. It's very effective indeed for really helping you heal the anxiety, changing the underlying cause of your anxiety, breaking free from that pattern of habitual reactivity that causes your anxiety. Mindfulness training brings more consciousness to your anxiety, so you see it more clearly. And when you can see it more clearly, you're much more able to break free from those habitual reactive patterns, which of course operate out of consciousness, as all habits do. So the first step in the mindfulness therapy approach is to develop a conscious relationship with your anxiety, learning to see it more clearly, and learning to break free from the reactivity that gets triggered in response to that anxiety. So this is the first step, learning to see your anxiety clearly. And then the second step is responding to your anxiety with compassion and friendliness and the very qualities of mind that anxiety needs to heal. It cannot heal if we avoid it, and it cannot heal if we react with hatred towards our anxiety. And it cannot heal if we simply become lost in those habitual patterns of reactivity. But once we start developing a compassionate relationship with the emotion itself, then we can greatly accelerate the rate of healing and recovery and resolution and freedom from these anxiety-producing habits. So that's the main focus of mindfulness therapy, and it's very effective. And most of my clients see quite dramatic changes and improvements and reduction in the level of anxiety that they experience after the first 3 or 4 weeks working with me. I see people once a week usually for about 60 minutes for each session. That's usually sufficient. I don't believe you can do effective therapy under 60 minutes. Sometimes I go to 90 minutes. It depends. The focus of the online therapy that I offer is to work with your anxiety and actually do practical mindfulness work and exercises, including mindfulness meditation, during those sessions. The goal is to teach you methods that you can use yourself so that you don't become dependent on a therapist. So if you'd like to learn more about online therapy for anxiety, do please contact me and we can schedule a trial therapy session via Skype, and you can see for yourself just how effective mindfulness therapy can be for allowing you to break free from the habit of anxiety. Thank you.